Good afternoon, everybody, and welcome to today's debate on the future of cancer services in Wales. My name is Will Hayward. I'm the Welsh Affairs Editor at Wales Online and the Western Mail, and I'll be chairing this afternoon's debate, which is being jointly organised by Macmillan Cancer Support and Cancer Research UK. The value of this debate should be obvious to everyone, but I'll add that my dad was actually diagnosed with cancer back in December of 2020, and after some quick surgery, some great care, and some swift follow-up, has now had the all clear. So I can personally attest to how vital this debate is. We're joined today by representatives of Wales's three main political parties. In alphabetical order, we have Rhys ap Iorwerth from Plaid Cymru, Angela Burns from the Welsh Conservatives, and David Rees from Welsh Labour. Now, to ensure that everything runs smoothly, people have been asked to submit their questions in advance. Several themes have been picked out from these, and we've ended up with a list of 8 wider questions for discussion. That's a lot to get through in an hour, but we're going to give it a go. So to the political representatives, we're going to be aiming to give a 2-minute response to each question. And I will give the candidate a little wave as we get nearer the time. So if you see me waving, don't worry, it's just a note for the candidates. So with that said, let's get straight to the questions. So the first one is on recovery from COVID. Cancer services have been impacted by the pandemic, and delays to diagnosis and treatment have resulted in a significant backlog. What commitments will your party make to address this backlog as quickly as possible and to encourage people to get potential symptoms checked as soon as possible? We'll go to Plaid Cymru first.
Well, very good afternoon, everyone, and Angela and David, and to Will, and thanks for the invitation to be here this afternoon. Listen, we're facing an unprecedented challenge, and whoever is going to be holding that health and care brief from May the 7th has an unprecedented job. My party's attitude over the past year has been to support and back Welsh Government action where we think they've been getting it right, and to hold them firmly to account where we think they've been getting it wrong. And actually, one of the areas where we think there has been a serious problem is in dealing with the flow of patients through health, non-COVID patients through the health system. The failure to put a system in place that created the kind of COVID-light capacity within health has contributed, no doubt, in my mind, towards the problem that we face now and the backlog that we face. We have to now, therefore, face to an even bigger mountain that we would have been facing anyway. That means that getting in place those kind of safe COVID areas, or as safe as possible COVID areas within the health and care system, is absolutely vital. Getting the workforce in place right now is absolutely vital, and realigning, if you like, the cancer workforce. We have to be making sure that we accelerate like never before the kind of diagnostic innovation investment that we need to make sure that people come through the system now quicker than they usually would. This cannot be a period of getting us back to where we were. It has to be a period of transformation. You'll hear me saying that a lot in the next hour or so. And nowhere perhaps is that more important than in the area of cancer, and getting patients now through the system, transforming the diagnostic system, and then transforming the way that we give quick treatment in order to give ourselves a fighting chance in the situation that we find ourselves in.
Thank you very much. If I go now to David Rees. I think you might be on mute, David.
Yeah, I was. Thank you. And can I thank everyone for the invite this afternoon, and also my colleagues in the debate. I think it's important to recognise that the Welsh Labour government has already put a recovery plan in place and has already invested £100 million as to make sure that plan can continue. So the election doesn't get in the way of that plan getting going. So there is already movement in place. Now the question is, how do we make sure that that recovery plan continues? And Welsh Labour has already indicated it's one of its main pledges is that it will invest in the NHS recovery and be one of the biggest investments going, so that we can get the treatment which have been delayed, we can get the diagnoses which have been delayed, and we can encourage more people to come forward so that they're able to have confidence in coming to a GP or confidence in going to the hospital, and that they will not fear any services, so whether it's COVID or any other else around. They will have that confidence, and we can get them into the system as quickly as possible. We introduced the single cancer pathway. Everyone recognises that's a successful approach. When the Cancer Cross-Party Group put the report out, that is one of the positives that came out of that report. So we are in the process of continuing that now. What we now need to do is catch up. We have no doubt had seen problems. At one stage, we were, 75% down on what we would normally have expected in people coming forward. So there is a deep catch-up we have to do, and we need to do it quickly because we don't want people coming late diagnosis, because that means more challenges for the individual and less, so we say, less reliability on how we can get that patient treated, and we need them as soon as possible. So Ryan has identified the important thing, but unfortunately, workforce don't appear overnight. We've got to develop our workforce, but it's not going to happen overnight simply because they need to be brought into the system, they need to be trained, they need to be developed, and Welsh Labour is already investing over £200 million. And I can see the waving, so I'll stop there because I'm sure these will come up afterwards.
Thank you very much. Angela Burns.
Yes, thank you. Good evening, everyone, and nice to be talking to you, albeit through this now very familiar medium. Of course, both David and Reen have, mentioned the absolutely important factors of ensuring we have a workforce, ensuring we have good diagnostics, and so my party is saying exactly the same kind of thing. But let's be really clear. This is, and anybody who tells you any different is just not playing a straight wicket. We have a completely knackered NHS. They have worked superlatively well over the last 12 to 18 months. We want and need to have all of our treatments back up and running in a safe, secure environment, but our workforce is on its knees. We don't have, as David said, it takes months, years to get the workforce in place. We do not have people on standby who can just step in. So one of the key things we're going to be doing is formalising the structure for the NHS reservists. We're going to be using and trying to bottle all that immense goodwill that's come our way over the last 18 months of people who used to work in the NHS, who used to be in diagnostics, used to be cancer specialists, used to be nurses, doesn't matter what they did, and actually put them on a sort of a formal footing where we are going to pay for them to have CPD, pay for them to be current, and be able to use them in order to, one, alleviate the pressures on the system while we try to get up to normal business while still dealing with the fallback of or the fallout from the pandemic. But secondly, also enabling our current workforce to take some of that time out, to regroup, to gather their strength so they can come back into the fray. We published our manifesto today, and the other very strong commitment we have is that we will have a cancer delivery plan in place. There are 4 delivery plans we will deliver within the first 12 months, cancer being one of them. We believe this is really important because without that good roadmap forward, we're not going to find the direction of travel we need to go in.
Thank you very much, Angela. So the next question is around workforce. Staff shortages in Wales's diagnostic, nursing and wider cancer workforce have limited the progress we've made in early diagnosis, survival and patient experience, and addressing the backlog will require even more capacity. What will your party do in government to ensure that Wales has a cancer workforce that is fit for the future? We'll go to David first.
Thank you. As I said in my previous answer, we've already talked about for this year's budget, invested in an additional £228 million. We are going to make sure that funding is there for the people. And we are looking at doing extra training in medical places. We've talked about, and let's not forget the allied professions, because this is really important, the diagnostic centres. Very often we talk about doctors and nurses, but let's remember the radiographers and the occupational therapists, the other allied professionals who are critical to ensuring the care of patients at this point in time. And we'll be making sure that the investment covers the whole range. So we are already doing that, and we will continue to do that. And new cancer, new training areas will include gastroenterology, urology, general surgery, oncology. These are areas which I know are important to cancer specialists and cancer surgeons. So we are putting that into place, and we will continue to do that. We recognise, and I recognise more than anything else, I'll open up here, my wife is a radiographer, so I know full well the services, the importance of the whole workforce in delivering the care for patients. And that is what we will invest in. I see, Will, before you have to shake your hand.
Fantastic. I hadn't even had to unmute. That was impressive. If we go to Angela next, please.
Yeah, thank you. I mean, that's a really good question. And workforces aren't magicked out anywhere. And we can all say that we're going to give thousands more doctors, thousands more nurses, but how we actually get people, how we attract people into the profession. Because your questioner asked about what we're going to do to get more cancer specialists in place, whether they are radiographers or whether they're nurses or doctors. But you have to go back one more step. We've got to get more people into the workforce, full stop. So for example, we have come up with a range of initiatives, and the one I want to talk about very briefly is our apprenticeship scheme to get more people into nursing. This is a way of being able to attract people into the profession who might come from walks of life or from areas where they've never thought that they would ever be able to break into nursing because they don't have the money, or they don't think they've got the right kind of qualifications, or they haven't got the confidence even to go for it. And we want to put in place a nursing apprenticeship scheme that's earn as you learn, fully funded, fully supported, where people can join up from school, from 16, from GCSEs, and work their way through to the point that they arrive where they want to do. Why is this important? Because by bringing people in at the bottom, from filling from below, you then free up people who've got a bit more experience who might think, I would like to specialize in being a cancer specialist nurse. I would like to specialize in this. I would like to go into diagnostics and really look at what I can contribute in this particular field. And at the moment, we have a workforce who's so tight, there's so few of them, they don't have that ability to really do on-job training, CPD, develop their particular interests. So we need to get more people in at the bottom, and then they'll grow and we'll replace them with more people. We've costed it £17 million, buys you 500 nurses. For nurses, read doctors, read allied healthcare professionals. We can work our way through this.
Thank you very much. And if we go to Reen, please. I think you might be muted as well.
Not only was I muted, I couldn't find my mouse, but there we are. I'm now unmuted. I mean, one thing that I've learned, I think, in being involved in the health committee, in particular in the Senedd, is that workforce is at the heart of what needs to be resolved in order to sort out health and care. And actually, I should mention here, Clyde's plans to genuinely bring together health and care, to me, provides a wonderful opportunity to create new career pathways, creating a larger cohort of health and care staff, all the way through from care through primary care and then secondary and tertiary care. It has to be resolved, and I have no doubt that now is the time where the people are with us and are willing to help. There is more interest in going into health and care careers now, after the experience of the past year, than there has been for some time. There is clear evidence of more applications to go into care roles, to study for nursing or medicine, whatever it might be. So let's tap into that and make sure that for the medium and the long term, we really are building sustainability in. I talked before about the sort of road shows that I want to see, travelling the length and breadth of Wales, teaching people about how to look after their own health, but also encouraging careers in health and care. I could talk about the 1,000 doctors, the 4,000 nurses, 1,000 allied health professionals that we want to create through these innovations, and that will take time. But also, in the last few seconds that I've got, we need to take the pressure off staff that we already have in place. We're talking in our manifesto about the need to provide, make sure that staff have the counselling that they need after the coming year. But I tell you what, from my experience talking to people working in health and care, what they want to take the pressure off them is to know that government is building a sustainable system within which they can work properly.
That leads us neatly onto the next topic, which is prevention. So 4 in 10 cancers in Wales are preventable, with smoking, tobacco and being overweight and obese 2 of the biggest preventable causes. What steps will your party take to help reduce these preventable cases of cancer? And we'll start with Angela, please.
Yeah, thank you. Actually, last week, Reen, I and Vaughan took part in another hustings, and I said that our motto is prevention is better than cure. And if you look at our manifesto, you will see that we have put an awful lot of effort, a lot of thought, a lot of policy development, and a substantial amount of funding into prevention, into whole population health. And we've got some very clear plans about what we need to do, because you're right. There's an awful lot of people in Wales who come from perhaps less advantaged backgrounds, or who have live in areas where they live in very poor housing, where they're not able to sustain a lifestyle that might be more conducive to having a better health outcomes. We are a very unwell nation in some areas, and we have put together a manifesto that is really all about how do we sort out issues such as getting our housing right, such as getting our messages out, such as tackling obesity, tackling smoking, encouraging people to just be more fit, to take more exercise, about starting at the very youngest in school, getting more hours into our primary school day, getting more hours into secondary school exercise, building the habits of a lifetime. Something I keep telling my teenage daughters, I have to say it falls on deaf ears an awful lot of the time, but it's about building a habit of a lifetime. If you get used to doing it now, you will still be doing it when you're 40, when you're 60, when you're 80. And we've got very clear plans. I can go through them all, Will, but I don't have the time to do it. But population health, prevention, ensuring that people understand what the triggers are, and giving them the support and the levers to be able to do something about it and not feel that they're on their own. Getting that educational message out there, it's completely vital. Things like, dentistry. We all know how important it is to have healthy teeth. It actually makes an enormous difference to the health of the rest of your body. So yeah, lots of ideas, and hopefully you will have a chance to explore those later.
Hopefully that hasn't fallen on deaf ears as well. So if we go to Rena Pula.
Thanks, Will. We've got to put prevention right at the heart of the delivery of health and care services. We can't think of something, as prevention as being something over here in order to take the pressure off health. The way I've tried to explain it in hustings like this before is the position I want to get to is where we can spend health budgets on football pitches. So the prevention, the keeping people healthy, building active travel paths, whatever it might be, is seen as part of health delivery. And I'm not naive enough to think that it's easily done, but I'd really, really like to be the health minister that is seen as the one that really started the transformation of our relationship with our own health here in Wales, and be it from that roadshow that I want to have an impact within our communities that everybody knows about. It's that thing where they're telling us what we can do ourselves to keep ourselves healthy, where children spend more time doing physical activity at school, where I was ridiculed in Plaid Cymru a few years ago for in the Senedd by other parties, or Plaid Cymru was ridiculed for suggesting we should have a fizzy drinks levy. Now it's accepted as the norm. It's being introduced on a UK level. I want to see an unhealthy foods levy in the same way. I want to change slightly our relationship towards smoking. We need to hammer down smoking numbers by really understanding that this is an addiction where people need assistance to stop, and giving them the assistance in that way. And we need to be spending money in a way that is genuinely seen as the core of transformation within health and care. I really can't overemphasize how much of a priority this is for me in Plaid.
Okay, health budgets on football pitches, presumably not part of a European Super League though. If we go to David Rees.
I think we must be reading our manifesto where we say prevention and well-being must be at the heart of what the NHS does going forward. So it's clearly within our brief and our agenda to make sure that prevention and well-being is going to be the heart of where we address issues in the NHS. And we understand, as Angela highlighted, poverty, obesity, all those other aspects, the underlying health conditions, the disabilities people have, they're all part and feeding into the various conditions and treatments we need to have, whether it's cancer or other conditions. They are there, and we need to address all those aspects. So the social agenda, as well as the health agenda, need to be worked together. And whilst Labour's already shown its agenda on smoking, we've already introduced bans on smoking. We've extended that ban into hospital grounds. So we are seeing it already happening. That's in place already. Obesity is the next one to tackle. Irene and Angela are both right. It's about the public health communication and education we need to put forward. The new curriculum has a well-being aspect of that curriculum, and that will also be helping young people understand the implications of obesity, the implications of healthy eating, the implications of smoking, and what it has on you. It's not just being a part of the gang, the long-term implications of that. So it's all coming together as a way of getting people to understand what actually health inequalities are. And Labour has already identified it wants to address the health inequalities across the world. And these are aspects of that set of health inequalities. And we will be funding part of our work doing exactly that. We all, I think every one of us who sat on that sits on the health committee at the moment, and those of us who wish to go back, whether it's our minister or not, or whatever, we all understand the preventative agenda can save both lives and funding. It can make sure people's health is better, but then as a consequence of that, we spend less money on treating people who don't need to be treated anymore. So it's a combination of both. So we do recognize that, and Labour has already started that process and will continue with it.
So thank you. So the next part is on cancer strategy. Cancer charities in Wales through the Wales Cancer Alliance were opposed to the decision to develop a quality statement for cancer instead of a more detailed strategy or delivery plan. What is your party's plan? What are your party's plans to drive improvements to cancer services in Wales in the medium to long term? If we go to Reen from Plaid Cymru.
Thanks. I mean, this really cuts to the heart of what we need to get working on in government. We've seen the response to the quality statements. It is not what those who understand what is needed in terms of developing cancer services in Wales want. We needed a new cancer strategy before we entered this pandemic. The fact that we are now hopefully moving towards the latter end of the pandemic, but that we still do not have a new cancer strategy is hugely worrying, and I know is causing desperate concern amongst cancer charities, for example. I, as Minister, want to put a new cancer strategy in place. The reason we can't at this point in time talk about the detail of how that would work is because the work hasn't been done. The work, and I know how stretched everybody has been over the past year, absolutely. But now is the time that there is expertise, there is a will within the cancer family, if you like, within Wales, to build a new strategy that can help us deal more effectively with the challenges that lie ahead of us now. It is of regret that we are still at this point and still having to make that call, but at least now, with the possibility of a new government being put in place, we know that we can begin this work within a matter of weeks now.
Thank you. Angela Burns from the Welsh Conservatives.
Yeah, thank you. I'm really proud of the fact that my very last ever question to the First Minister was on exactly this, because I was absolutely horrified by the 3-page statement that came out on the cancer plan. And I reread earlier on the answers that the Minister gave to myself, and to be fair to David, because we both asked on that question. David followed as a supplementary. And one of the things that Vaughan said was that he wanted to put together, and put it down here, develop an implementation plan to support the statement instead of building. He wanted to develop an implementation plan to support the statement. So my question to the Welsh Government is this: why? You have a delivery plan. It's not been perfect, but it's actually achieved an awful lot. And what I'm really worried happens is we constantly are in this cycle of reinventing the wheel, reinventing the wheel, reinventing the wheel. Yet we have a delivery plan. What we should be doing is building on it, looking at it very clearly, looking at what worked and making more of it, looking at what didn't work and change that bit of it. We have committed very, very clearly to 2 things. One, that in our first 12 months, we will have a delivery plan for cancer put in place with the professionals, with the patients, delivered and working and funded. Secondly, we are driving forward with our rapid diagnostic centres. We're going to have them all across Wales. The whole point is that it's to speed up that process, your GP is concerned, you have a concern, you have fast access to good diagnostics, and you know what the situation is. We all know the sooner we can deal with this issue of cancer, the sooner somebody knows if they're not well, the sooner the treatment can start, the better the outcome. We're very clear. Those are our two commitments to you.
Thank you very much, Angela. Your audio is crystal clear until you move slightly to the side, and then we lose
sorry.
you. So no, that's no problem.
I get too excited.
Over to David Rees from Welsh Labour.
Well, you put me in a spot now, because the quality statement of the Welsh Government and Welsh Labour has identified it's a sort of clinical framework it wants to move forward with, a framework of standards it wants to try and achieve. And the quality statement for cancer is part of that set of standards it wants to achieve within delivering services for cancer care. Now, as chair of the cross-party group in cancer, of course, I supported the report which called for a delivery plan and a new updated delivery plan. I also, as Angela highlighted, I asked questions upon the quality statement. So the party, I'll go to the party line in the first instance first. The party has put forward this quality statement with the view that if we identify the standards we want to have in delivery of care and the services people receive, then we expect that the implementation plans from the health board to meet those standards. And we want the health boards to come forward with their implementation plans so we can ensure ourselves that the standards in the quality statement are being delivered. That's what the approach is going to be. On a personal basis, now, and I'm going to speak off piece in one sense, I still think there's a need to address how we make sure health boards are consistent across Wales in delivering those standards. Because you could certainly meet standards, but there may not be consistency there. So we have to ensure that I think the quality statement that comes through has additional strengths within it to ensure that every health board has to do certain things to meet the same standards, consistency across. I think that's the role of perhaps myself, and as a backbencher, and also part of the cross-party group on cancer that comes through, is to ensure, and we hold the government to account to deliver on that. There is still a lot of work to be done. Let's be honest about that. And I think I can understand the Welsh Labour Party going forward with what they want to try and achieve, a set of frameworks across various conditions, make the standards clear, making sure health boards have to meet those standards, but we want consistency as well. So we have to put into place what we require in the consistency agenda. So that is something I think we will have to do as all members. I work with every member who want to do that. I will work them all to make sure that we get there.
Thank you very much. That was incredibly diplomatic. Well done. So the next one section is on Velindre. Now, I get a lot of emails from this in my role at Wales Online, and there's a lot of passion on both sides of the debate. We've had several questions from both sides of the debate around the new Velindre Cancer Centre. What is your party's position on the development of a new centre? And we'll go to Angela Burns first for this one, please.
Yeah, actually, really clear. I believe, and my party believes, we need to have a new cancer centre. There's no doubt about it. And, don't let the fog get in the way of the clinical necessity to have that sort of centre of excellence that can be the hub of a whole series of chains that can spread out through Wales and deliver good quality cancer services. I have read some of the stuff from professionals who say, no, it shouldn't be this kind of model, it should be something else. But I'm completely persuaded by the clinical model and I would support it. What I'm not so clear about, to be honest with you, is the location. If I had a magic wand and a gazillion pounds, I would like to build a brand new Heath Hospital on a fantastic location with wonderfully easy parking and the ability to have entryways in all of our specialisms. So some poor person doesn't rock up at the front door and then have to walk miles and miles and miles down endless corridors to get to the place that they need to be. And I would like to put the cancer centre right down next door to it. But, we don't have gazillions. It's got to go somewhere. I know there's a lot of controversy over the proposed location. I bow out of it. I'm not a local, but what I am telling you very clearly, we must have that cancer centre. We need it. And I would like to also see a replica one in North Wales to give us that balance and that strength across the nation. They should be the pivots for developing our cancer treatment, diagnosis and treatment strategy throughout Wales.
Thank you. David Rees, what's your party's position on the development of a new centre?
I think we've already made that quite clear because we have approved the current centre. And Angela's quite right. we need that centre as soon as possible. We need it to be built. We can't afford to wait another decade as more discussions go on as to where should or where shouldn't go. The location might be a question for many people, but if we delay any longer, we're going to delay the centre. And we need that centre because people need that type of treatment, and they need the innovation and the technologies that that type of centre will offer them. And we're in a world where it is critical we have those technologies available to ensure that modern treatments are available to people who need those modern treatments. So that hub, that centre is critical. So Welsh Labour has already made the decision where it's going, and it's going ahead, and we will continue with that. I think that's a very simple answer. Andrew's highlighted very much so that there are various models around. I'm not a medical expert, I will be honest about it. I will take the advice that has been given and what we're told. My biggest concern is, if we don't get on with this and we spend more time, we'll end up with another project which has just been discussed and not delivered.
Yeah.
And we need delivery here. People need delivery. They are waiting for that centre. They are waiting for the treatment that centre can offer them. So let's get on with it and let's deliver that centre.
Thank you very much. Reen.
Yeah, thanks. Yeah, we need in all parts of Wales to have the kind of cancer centre that there's an aspiration to develop here in the southeast of Wales. I've tried to really learn what's at stake here. I've spoken with Velindre. I've spoken with campaigners against the proposal there. I should say, campaigners locally seem to have, appreciated that I won't get involved in the planning side of it. If you understand it, that's for the local community, and I know there are very strong feelings about it. My interest is in making sure that the southeast of Wales, in this case, is getting the best possible cancer centre and getting it as quickly as possible. Now, I have a huge amount of respect for the team at Velindre, Tom Crosby and the team there. But I do also have a great deal of respect for the significant number of clinicians and others who've raised real doubts and very valid concerns about the proposal to build this standalone centre. And I'm on the record saying I'm really disappointed that Welsh Government didn't seem to think it was a sensible thing to try to provide answers to those concerns that could build confidence that the right centre is being developed for the right reasons. It may well be that the Velindre proposal is the best option, but there is another option, the Heath option. Is there a way of delivering it? Why did Welsh Government not try to address those concerns in a way that was seen to be addressing those concerns? Last thing I want to do as Health Minister is slow down the delivery of a new cancer centre. I'm sure the same would be true for other parties too, but absolutely, I want to make sure those concerns are heard and addressed.
Thank you. I'll take you guys away from the murky area of local planning now, and we can talk about cancer research. The unprecedented levels of investment into the development of a COVID vaccine raises questions around funding available for other areas such as cancer. What commitments will your party make to ensure that cutting-edge cancer research and the delivery of the next generation therapies will be appropriately funded over the next 5 years? And we'll start with David, please.
Oh, that was a nasty question, isn't it? Because we're talking about a slightly different area in the sense because we're talking about an area of research and development. And it is critical. Now, what we are seeing, unfortunately, is many of our cancer charities have been doing this research suffering as a consequence of the COVID because they haven't been able to get investment from other sources. And we need to ensure that government, and I think, when I have to say this one, it's governments across the UK, it's the UK government as well as the Welsh government, to look at how we can invest in the research and development of treatments within cancer services. And we will continue to do what we have been doing to date. We will continue to ensure that those services, those researchers are worked with as much as possible. We will hope to work with clinical trials again, as we've been doing in the past. We will look into support the research and development through a variety of funds, not just the healthcare funds, the health board funds, but through the funds of innovation, economy, over the funds of education, those aspects which are all fund research and development, because it's not just health research and development funding. And we will make sure that's there. But I will be honest with you here. This is, I think, an approach across the UK. The whole of the UK needs to look how we will fund research in health conditions, whether it's cancer or other health conditions, to ensure that we deliver, as we've done for COVID, we'll deliver for other conditions as well.
Thank you. Rina Fiolov.
Thanks, Will. I certainly agree with David that there's an issue on a UK level here. We've only got to look at the way research funding as a whole has been distributed over the years, and it is very, very clear that Wales is not getting anywhere near, I believe, well, anywhere near a sort of population share, but anywhere near a share of what our capacity is in research and what we could benefit from through leading research. We want to see Wales's share, if you like, of UK research and innovation expenditure being devolved, so that it is, if you like, ring-fenced in a way that doesn't mean that Oxford, Cambridge, sort of London triangle will always end up sucking in more than its share of research funding. I think we should be aiming to pretty much double the research funding that is available to be spent in Wales. I think Wales currently spends, it's around the sort of 1% mark of GDP on research and development in total. I think we should be looking to double that by, say, in a decade's time. And we have a new body that we'd like to see being set up called the National Innovation Body, and this is precisely the kind of work that innovation body could help lead, to make sure that we have the brains, we have the expertise. Too much of it leaks out of Wales because the research funding itself doesn't end up here. Well, let's see if we can embed more of that research actually here in Wales by making sure that the money follows the people who are able to do it.
Thank you very much. Angela Burns.
Yeah, Will, I was the chair of the cross-party group on medical research for the whole of this assembly term. And my cross-party group have produced a report which I've circulated throughout the Senedd to the library, and anybody who wants a copy, I'm really happy to send you a copy. We've been really clear about the stumbling blocks, the barriers to being able to increase our research and development on a whole range of treatments, not just cancer. But let me just say one thing, Wales does punch above its weight. There's an old saying, casting a long shadow, and we do cast a long shadow for a small nation. We've done some outstanding work, and we really lead in certain areas, including the whole T cells area and the whole targeting of treatments for specifically for cancer cells, viral vectors, you name it. We are outstanding on it. And the issue is to do with funding, but it's to do with both Welsh Government and the UK government. We don't get enough of the UK spend. The UK doesn't get enough of the European spend, world spend, the available research out there. And the Welsh Government have also stepped away from the plate. And one of the things I said in my report was that we have the ability, Wales as a nation, to be a superpower in terms of research and development, because we have got some outstanding medical schools that are supporting outstanding researchers who are making groundbreaking discoveries all the time. What they need is the funding support, not just the funding support, Will. We also need the ability to take the product that's developed and the ideas that are developed and to then marketize them, to get them to market, to get them to a producer, to get them into production and to get them to people. It's all part of that change. And finally, we have a commitment in our manifesto is that we will expand the Access to Treatment Fund, which will hopefully open the door to cancer therapies, more unusual and novel ones, to more people.
Thank you very much. So we're going to talk now about personalised care. The impact of the pandemic on our finances and personal well-being will be felt long into the future, but a cancer diagnosis can have a lasting financial and emotional impact on the individuals involved. What plans does your party have to provide consistent access to advice and support for people living with cancer? And we'll go to Plaid Cymru first, please.
I mean, this is at the heart of the kind of support mechanisms that cancer patients have. Our experience as a family was when I when I lost my my mother, nearly 10 years ago now. It all happened in a matter of months from diagnosis to her passing away, and we had to learn so much during that period as a family, from knowing nothing to dealing with the palliative elements and so on. I think we have to be making sure that not only do we build on the acceptance of the need of a key sort of contact within the cancer care sort of pathway, that really is delivered, that we learn at all times from the experience of cancer patients and their families about what makes a difference to the care that they get. It's another one of those elements of the cancer delivery plan, the new cancer strategy that has to be put in place, the support for people and their own well-being as they go through cancer diagnosis and treatment. And it's something that I'm pretty determined to deliver.
Thank you. I'm sorry to hear about your experience. I'm sure a lot of people watching can sadly empathise. Could we go to Angela Burns from the Welsh Conservatives now, please?
Yes, certainly. And let me be really clear. We don't have a particular cancer holistic support. We've got a support package for anybody who is diagnosed with a condition of severity, because that person not only needs financial and emotional support, but actually they need somebody who'll walk with them the entire journey. And one of the things we're not very good at is we're not very good at talking about dying. And dying is an outcome sometimes of a cancer diagnosis. So our entire, and not just cancer, there are many other conditions. So we actually have the view to put in place a holistic support mechanism for anybody who's diagnosed with a condition that requires that level of support to help people go through it, to help them cope with all the other things they might need. They might need physiotherapy, they might need occupational therapy, they might need housing adaptations, they might need to have financial help to get them to a specialist cancer centre to receive specialised treatment. And failing all things, they will also need support to make end-of-life choices, decide whether they want to, what kind of palliative care they want to have, what kind of end-of-life choice that they want to make. It's a whole package. And it doesn't just stick with cancer. There are many other conditions that have terminal outcomes if you are so unfortunate. And it applies to anybody who is diagnosed with that. It's about actually having a person-centered NHS where the money, the funding, the support moves with the person depending on their particular need at that particular time. I have a friend who is in stage 4 at the moment. She's only got a few weeks left. But I've seen how her support has gone from the early days when she needed very little to now when she needs an awful lot. That's what we have to do, walk the journey with them.
Thank you very much, Angela. And to Welsh Labour.
Sure. And I suppose that, the question was asked about how can we ensure that people are supported during their diagnosis and beyond their treatment, and as well as the palliative agenda, which perhaps for some people will be the end result in that sense. So the original delivery plan highlighted the key worker agenda as an aspect of that, and every patient should have his key worker, and the key worker ended up being the clinical nurse specialist usually. And when we did the review of that back in the 4th Assembly, we did identify that was still an area to be dealt with. I know that's got better in the 5th Assembly. So the ability to actually make sure every patient has a designated key worker, and every patient through that key worker is able to access the support from the various organisations that are around. Because Andrew's quite right, there'll be different elements of support. Sometimes at the very early stages, you may need social support, you may need support because your finances have gone, because you're not working, because you're going through treatments. There's different elements of support as you go through. And if you get to a stage where your cancer deteriorates, then of course you'll need different forms of support, more clinical support in that sense, and then the palliative care. The Welsh Labour on the palliative care side has already got this manifesto commitment and need to review the whole process to ensure that we are delivering the palliative care agenda. And we've already put money in to help hospices. During the pandemic, an extra £9 million was put into hospices to help them during this difficult time, because many hospices, of course, rely upon donations, and when you can't get it, it's difficult. So we understand that side of it, and we need to support and continue supporting hospices. But we also need to make sure that once a diagnosis happens, that person is linked into all different support mechanisms that are there. Some need it now, some may need it later, and perhaps some may never be needed because their treatment cures or comes to a situation they don't have that need. But it is important that that key worker is identified early and is working with the patient and the organisation to get that support.
Thank you, David. And I think the next topic we're going to speak about, some of you have already touched on, but it'd be good to get some real commitments and some more details on it. It's palliative and end-of-life care. The pandemic has placed new demands on our palliative and end-of-life services, with a significant increase in the number of people dying at home over the past year. What plans does your party have to ensure adequate funding for services in Wales, including hospices, to ensure that people's needs are met at the end of their life? We'll go to Angela Burns first, please.
Yeah, thank you for that. We have a commitment to increase funding for hospices, but I think it's more than that. Well, I think we've got to go back to some of the things we were talking about at the beginning about preventative, about taking ownership, about encouraging people to take ownership of their health. Sorry, about education of children, education of young people right at the very beginning. And the whole business about how we die and how we die well is part of that whole discussion. I've made no secret of the fact that I believe we should have a very serious and open dialogue about assisted dying. And I think that it's one of the ironies of life that from the moment we are born, we are asked to make choices on everything, and we are encouraged to make choices, and every party runs around saying, we're giving you, the choice of where you go to school, where you want to live, what you want to do, what kind of education, what you want to do with your kids, and right at the very end, we don't always give people the choices that they want. So I would like to see this whole dialogue happening, not just with the ones we know about, palliative care. In Carmarthen, West and South Pembrokeshire, there's an outstanding organisation called Paul take palliative care into the homes. Marie Curie are absolutely amazing. And then, of course, we've got the big beasts like Macmillan, who are just fantastic in supporting people through these very difficult times. But it's got to be about more than that. It's got to be about us having a conversation as a nation and as a people about how we see our end of life happening and not being afraid to talk about it. We all know families where people just didn't want to talk about it because no one knew what to say. We have to move past that.
Thank you. You mentioned, you gave a shout out to a local organisation there, but your microphone broke up a little bit. Did you just want to say their name again?
Yes, certainly. Paul Sartori in Pembrokeshire, and they take palliative care into people's homes. So again, that's giving a choice between going into a hospice or having your palliative care in your home. Very, very important. It's all about choice, and it's about that person. And we've all mentioned, all three of us, I think we're very much on the same page about holistic care for the individual, and it doesn't stop at the end of our lives.
Thank you. David Rees.
Thank you, Will. And I suppose we got to remember, I just talked about the conversations we have, and the current First Minister, when he was Health Minister, established Byw Now, of course, which was all about talking about exactly that, how we sort of come to, how we live now, come to an end of life which suits ourselves. And in case people on this call don't understand, but one of the first people who led on Byw Now, Howard Francis, unfortunately passed away recently as a consequence of cancer, as it happened. So he also understood the Byw Now agenda. So Welsh Labour has already put into place an understanding of that conversation, an understanding of the need to look and reflect upon end of life and making sure we live life before, but we have end of life which meets that life before as well. So Welsh Labour has already committed in its manifesto to focus on end of life care, and we will review the patient pathway planning, and we will review hospice funding. As I said earlier, we've already put £9 million extra into hospice funding during this pandemic, and before that, extra money was put in to hospice funding. I do apologise for the dog, I can't help that one, unfortunately. But so we are looking at it, and the Welsh Government is already working with the end of life board to ensure that we review funding for adult and child palliative care agenda, because let's not forget that unfortunately we have children who need that care as well, and their families. So we have to, and we are doing, and we're committed to reviewing that to ensure we meet the needs of those who require the services of hospices. And in Angela's case, for example, whether hospice is actually in a building separately or that hospice concept is placed in people's homes. We need, our Welsh Government is going to review all that and make sure it fits purposes, and the NHS meets those needs.
Thank you. Don't worry about the dog. Have you really had a working from home Zoom call if a dog or a child hasn't interrupted at some point? We'll go to Irene next, please.
Yeah, I think I'll probably talk to more about death and dying over the past few years than ever before, and I mean that in the most positive way. Through my work with Marie Curie in particular, I host have been hosting many of Marie Curie's events in the Senedd, and I've learned an awful lot, and I've come to appreciate, hopefully, and that's through the work of the cross-party group, just the importance of accepting dying as a part of life, and talking about how we can ensure the best possible end of life for everyone. I'm certainly committed to making sure that hospices and palliative care is on a sustainable financial footing. I think it was the very last debate on the last day of the Senedd. I took part in a short debate on palliative care for children in particular, where we have to make sure that the funding is there. We have to address the issue of inequality of access to palliative care in the community. Then there's a crossover there to the need for investment in community nursing and so on. But you said in asking the question, there have been more deaths at home in the past year. And that is something that we have all been keen to want to facilitate. But of course, these have been extraordinary times, and we have little ways of measuring the quality of the way people have been able to die at home during this extraordinary COVID year. So hopefully this is something that we can work on cross-party in the years ahead to deliver a palliative system, if you like, that we can all be proud of and as assured as we can be that provides real equality for people wherever they are in Wales.
Fantastic. We're quickly running out of time. I'm going to try and eke every minute we can out of this. So I'm going to ask you one more question. I'm just going to say if you could answer in just 1 minute each. And to do that, I'm going to ask you a really complicated question as a treat. This is around access to treatment. There have been several questions on a so-called postcode lottery of treatments. What steps will your party take to make more medicines available on the NHS? And we'll go to David first, please.
I knew you'd come to me first on that. Obviously, well, the Welsh Government in its last 5 years has put in the treatment fund and ensured that new treatments have been supported. And 80 million pounds of the new treatment fund is there. So the Welsh Government is committed to ensuring that continues and we're able to allow access to new treatments. That's not going to change. We continue to move forward with that. Now, the question you really want to know is, how can we ensure equity across Wales, which is important. As I mentioned before, it is critical that we do that. It should never, ever be a postcode lottery, and therefore health inequalities should be addressed as a matter of urgency, and Welsh Labour has got that in its manifesto commitment to ensure we address the health inequalities. And therefore, consistency across Wales becomes something we don't talk about in the Senedd anymore, because everyone's getting the same treatment no matter where you live. How's that for a quick minute?
That was succinct. Thank you very much. Can we go to Reen next, please?
Yeah, that equality means many things, doesn't it? Equality of access has to be geographic, it has to be social, it has to be, what the illness is. I think there have been some positive developments in terms of the new treatment fund. There was some disagreement between my party and the Conservatives on what conditions should be covered, and I was certainly pleased that it's not just cancer, that the new treatments fund was aimed at all illnesses. Listen, we will be seeking and finding new ways of treating illnesses, including cancer, all the time. And I don't think I'm saying anything particularly new in predicting that the rate of change will get greater and greater as time goes by. We need to be making sure that everything possible is done to ensure the best possible access to people wherever they are in Wales, to the best possible treatments, and that Wales learns from what's happening in other countries at all times too. We have to look outwards.
Thank you. And finally, Angela Burns from the Welsh Conservatives.
Yep, the easiest way to end the postcode lottery is to have a proper governance and management structure in place Wales-wide. And that is by creating an independent NHS Wales. We do not have that. People think we do, but we don't. An independent NHS Wales who has the ability, the oversight, and the responsibility to hold the health boards to account for their delivery of services. It doesn't matter what those services are. That's how you stop your postcode lottery. To get the health boards to do what they need to do, which is actually deliver the end result, to deliver the workforce, deliver the treatment, look after the people in their area. But they do that by cleaving to national ideals and a national policy on a whole range of key areas, and that is implemented and enforced by an independent NHS Wales. We've got that in our manifesto.
Fantastic. Well, that's all we've got time for today, I'm afraid. But a huge thank you to all three of our today's panelists. We're going to release you now to get back to the campaign trail. Thank you to the organisers of this event and to everyone else. Thank you for joining us, and we hope you found this event useful. Thank you.
Thank you.
Thank you all. Excellent sharing too. Thank you.
Thank you.